Oaks, success isn't just a goal, it's the essence of our vision to expect success. From our community-based services, including in-home support and after-school programs, to our residential treatment programs and foster care services, 4 Oaks touches the lives of children and families in all 99 counties. With your commitment, we will continue to support our communities across the state for many, many years to come. Thank you so much for your support.
Hi, welcome to Session 7 of Iowa Ideas, Vaccines and Medical Research. I'm Trish Mahaffey. I'm a reporter with the Gazette. I cover state and federal courts, and I'll be your moderator today. We're going to be discussing what Iowa is doing to promote vaccines, look at vaccine rates, and how will changes in federal investments in medical research impact both economics and public health. Before we get to our discussion, I want to take a minute and thank our presenting sponsor, ITC Midwest, and our track sponsor, 4 Oaks Family and Children's Services. Their support makes this conference free, so thank them. Attendees will be able to submit questions during the discussion in the Q&A box or the Zoom chat, and we'll probably get to those near the end. I'm going to go ahead and let our panelists introduce themselves and share a little bit about their education, experience, and training before we get started. If you want to start us off, Natasha.
Sure. Thanks so much, and thank you so much to our sponsors. I think Elizabeth and I are both going to make disclaimers that neither one of us are healthcare providers, so we can't answer questions about your rashes or specific questions about the vaccine needs that you have, but we study vaccination kind of at a population level. So I'm a professor in community and behavioral health in the College of Public Health at the University of Iowa. I was born and raised in Iowa, spent most of my life in Iowa City. Right now I live in rural Tama County. And since 2006, I've been studying the uptake of the HPV vaccine in Iowa. And during COVID, I worked on COVID vaccine uptake and trying to maintain our really strong vaccination rates in Iowa. So I'll let Elizabeth talk about herself.
Thanks, Natasha. Yes, despite working in public health for 30 years, my mom still thinks I'm a nurse, I think. But no, I'm not a nurse, not a healthcare provider, but yes, work in public health. So my name is Elizabeth Faber. I'm the director of the Iowa Immunizes Coalition. We'll get into that a little bit more. And I have studied public health. I have my master's in public health from the University of Minnesota, only because Iowa did not have a program at the time I got my master's. But I was also I was not born in Iowa, but I was raised in Iowa, and I have lived in north central Iowa with my husband and my 4 sons. We have lived here for the past few decades. Well, I'm looking forward to talking to you all about immunizations and all things vaccines here in Iowa.
Okay, thank you guys. I appreciate that. So Elizabeth, do you want to start us out? Can you tell us a little bit about Iowa Immunizes and what it does?
Yeah, so Iowa Immunizes is the project of the Iowa Public Health Association, but we are made up of many other organizations, in fact, over 150 other organizations and thousands of individuals across the state that all come together. We're dedicated to improving our vaccination rates and making sure that vaccines are accessible and information about vaccines are accessible to all Iowans. We have been in existence since January of 2020. Yes, I said January, so before COVID. So we did come together because of that, actually, not because of COVID, but because we had already started to see vaccination rates decline in Iowa, and all of those major organizations that track that and track policy related to vaccine uptake, vaccine confidence. We noticed that there are more and more policies being introduced at our state house that would decrease our vaccine confidence. And so the Vaccine Coalition, or Immunization Coalition, came together, and we officially launched in January 2020 and have been going strong ever since then.
Okay, great. Well, Natasha, do you want to talk to us a little bit about Iowa Immunization Research Network? Can you kind of explain that to us?
Yeah, so the Iowa Immunization Research Network is a much younger organization than Iowa Immunizes, but myself and a few other folks who work in immunization and vaccination space and do research have been members of Iowa Immunize since the beginning and big supporters. And as we went through COVID, really realized that there wasn't a space for immunization researchers to get together and talk about our issues and be able to collaborate and maybe be able to start studies together. And so I was able to apply for some money through the College of Public Health at the University of Iowa that allowed us to form this network of folks who do immunization work and research across the state. So we have people from ISU who are on this this network as well, people from Drake, people from DMU. And it's really an opportunity for anyone interested in doing immunization research, whether it's bench science, where they're like just studying the cells and trying to figure out how you develop a vaccine against some, disease, all the way to the folks who are actually testing different vaccinations. So we have an NIH-funded center here at the University of Iowa that is focused on vaccine testing. So as vaccines are developed, they're actually tested with Iowans. So when you think about those clinical trials for new vaccines, many Iowans participate in those clinical trials. So your neighbors are getting some of these innovative vaccines. But then we also have people like myself who study how, once you have a vaccine, how do you get it in a person's arm? Because most people are like, vaccines are great, but they're only effective if they actually end up in people's arms or in their bodies, so that it actually helps your body build immunity against preventable diseases. And so we have people across that whole gamut who study everything from, starting to do the science to figure out what viruses we might be able to go after with the vaccine, all the way to how do we get people to get vaccinations in their arms. And so this network allows us to participate in work together. It allows us to publish papers together. It has actually allowed us to apply for funding through the CDC. So we were awarded a really innovative CDC grant last year called the ARISE grant, Advancing Research and Immunization Services. And so we're one of 4 other centers across the country. And really, I think the reason we were selected was because we have this deep bench of people from, the cellular level all the way to the clinical level, who are really focused on how do we make sure that we have the best vaccines, the safest vaccines, and that people are getting them.
Okay. Well, then how do you, I guess, test these vaccines out? Or, I mean, I know you don't do it personally, but how does it come about, I guess?
Sure. So Dr. Pat Winokur runs this site, this center at the University of Iowa. And so after a vaccine has already been shown to be safe, so they've tested it, in animals, right? And they've tested it in a smaller number of humans, and they've had no negative outcomes. Then it comes to the part where they do clinical trials, where they will randomize people into a trial. And half of the people we randomly selected to get the vaccine, and the other half will not. And then they're going to follow these people over time and look to see, are they developing the disease that the vaccine was supposed to prevent? So does it work? And they're also going to be monitoring, did anything happen, right? Were there any side effects? Did they get a rash? Did they have a little bit of a fever? Did anything happen? And they monitor this. And there are multiple phases of these kinds of clinical trials. And each one includes more and more people in it, so that we're able to say more and more about the vaccine. And then once that vaccine trials have finished, and the government, the FDA, the Federal Food and Drug Administration, and the industry partner, the pharmaceutical company that might be developing it, and the university are convinced that this is strong data, then it would go to the FDA for their approval, and then it would go to the CDC for their approval.
Sure. And in the clinical trials, I'm assuming they kind of get a variety of people.
Yep. So many times for clinical trials, right, they want to get the most diverse group of people they can, right? Young people, old people. Some vaccines are more targeted to different groups of people. So if you think about the shingles vaccine, if you think about our current RSV vaccine, if you think about the pneumonia vaccine, Those are right now have really been targeted to older populations that are more at risk if you would get those things, of having negative outcomes. And so those folks would be recruited specifically into those clinical trials.
Okay, great. Well, what can you tell us, either one of you, on like the Iowa's vaccination rate? What can you tell us about that right now?
I'm going to start with this one, Elizabeth, and you can add.
Sure, go for it,
So
Natasha.
you both can answer this, I know.
We both can answer this.
Yeah.
So I think we're really fortunate that we're in a state that has always been have very high vaccination rates. Iowans are really in support of vaccines. We do a really nice job. We have folks who are really committed to getting vaccines in people, whether it's the Iowa Department of Health and Human Services or local public health or our pharmacists or our primary care docs. Everyone's really on board with that. And Iowans have responded by getting vaccinated. That has traditionally never been a problem. As Elizabeth mentioned, shortly before COVID, we started seeing some more hesitancy. We started seeing some rates of some vaccines among some populations starting to decline. And then in COVID, we saw, kind of decline that was related probably to not having access, related to not having some of those requirements being lifted because people weren't necessarily in schools. And then we didn't see a great big uptake in terms of people going back to the vaccination levels that they did before. We are not in a place in Iowa where it is dire. It is not an emergency, but we are in a place where we are starting for some vaccines among some groups of people going below what we call herd immunity. And herd immunity is that level of vaccination that we have to have in our community, in our state, in order to ensure that people who can't get vaccinated, like maybe the very young or some of the very old, or people who have cancer or have some kind of immune disorder, that they're protected. And so we're getting concerned because in some of our vaccination rates, we're seeing some dips. You can actually, as a member of the public, you can go to the Iowa Department of Health and Human Services website, and you can actually look at vaccination rates for the state. You can look at it by county. You can look at it over time. You can look at it for different age groups and for different vaccines. So it's a great tool that the state has that allows just individuals in our state to be able to kind of look at how are we doing on vaccination rates if I want to know in my community what vaccines look like. So I'd encourage everyone to go check that out.
Okay. I mean, have you looked at this close enough where you could tell us like what rates are declining? Or
so I think,
I'm sorry, I'm jumping on Elizabeth. You probably wanted to add to the question I asked initially. Sorry about that.
No, that's all right. I think Natasha did a great job of explaining kind of where we've been, where we're going, our history here in Iowa. I don't think that it would take a lot to go into the actual data. We could find that. We do know that historically, for instance, flu all across the country, the uptake of the flu vaccine is not as high as it should be. And it's important that we say that as we're going into those burr months, as we like to say, the respiratory season. And so as we are now in October, it's a great time to talk to your provider about getting vaccinated for influenza. That is a big one. Of course, we saw measles a lot in the news, especially there in eastern Iowa and across the country, and that continues to spread. We have more and more states. Our outbreak here in the United States is not ending, and so we do know that our herd immunity is too low in the majority of the states and in the majority of the counties within Iowa. So those are just some specifics, and I'm sure Natasha could talk about a few more. We obviously aren't as high with HPV to prevent HPV-related cancers. We have a lot of opportunity and a lot of different immunizations to increase our rates and to get more Iowans protected.
Okay. Is that one of the ones, the HPV, is that one of the ones that are kind of getting a lot of pushback on those, or people are hesitant to get them? Should say maybe.
Yeah, let Natasha talk about this one.
Thanks. So I mean, I do think there is some folks who have questions about the HPV vaccine. I think what we find with the HPV vaccine is that kids are supposed to get it between the ages of 9 and 12. And that's also the time when they're getting other vaccines that are required for school. So they're getting Tdap and they're getting meningitis. And so we do see that parents are like, my kid's already getting 2 vaccines. I'm not sure they need to get this optional 3rd vaccine. So we do a lot of work with healthcare providers to help them understand that this is an incredibly effective cancer prevention vaccine. It prevents 6 different kinds of cancer that are associated with it. And it's almost 100% effective. And so it really is by far one of the most effective vaccines we have. And it's incredibly safe. 300 million doses have been given out across the world around this vaccine. And so we see in countries like Scotland and Finland and Australia, where they require vaccination and they get whole cohorts of people vaccinated, they don't see cervical cancer anymore among those people. They don't see HPV infections in people's oropharyngeal or oral cavities. And so, we'd love to get to that place in the US and in Iowa where we could not have to say to someone, hey, you've got cervical cancer, or hey, you've got oropharyngeal cancer. So that would be a really meaningful vaccine for people to consider getting.
Okay. And so the HPV vaccine is the rates are lower, or they're
it's low.
declining?
Depending on the age group, we're about at between 45 and 56%. And the goal is 80%.
80%. Okay.
Yeah.
That's what I was going to ask. What is the goal?
Yeah, we've got a ways to go.
Yeah. Okay. And then I think I'd ask, what are any other rates declining on which vaccines, or do you know offhand?
I think one of the things that we see as like a way to monitor vaccine rate decline is this thing that we have in Iowa called a religious exemption. So every state has some ability for parents to be able to say, I don't want my child to be vaccinated. And sometimes it has to be attestation from a physician. In Iowa's case, the requirement was that if you had a religious reason that you did not want your child to be vaccinated, you could fill out the form that the state has and is available with every school nurse. And you would take it to a notary public, and then they would, sign, attest that you are who you are and that you have a religious exemption. About a year ago, that requirement of having it notarized has gone away. And so what we're seeing now is an increase of children who have a religious exemption on file at a school, because they haven't met the vaccine requirements, which now it's like about 3.6% of kids in schools in Iowa have this exemption, which is about 19,000 children in Iowa have this exemption on file. And what we do know is, right, there aren't any new religions in Iowa that all of a sudden are not supportive of vaccine. In fact, you can't find a mainstream religion that doesn't support the value of vaccination. So, we've been thinking about, well, how does this happen? Why do people look for a religious exemption? And, what we're suggesting or hypothesizing is that you go to, you put your kids in school, and then the school nurse calls you, the first week of school and says, hey, Bobby doesn't have all of his vaccines to be here. You need to call your primary care provider or talk to the county public health and get those vaccines. And a parent who, all parents are incredibly busy. Many parents have multiple jobs. Many parents are parenting on their own without much support. And the school nurse says, if you don't get those vaccines by a certain date, Johnny won't be able to attend school. And so parents start to panic. And getting into your primary care provider can be hard. Waits are long. Some people don't have a regular primary care provider, right? And so then you say, well, what am I going to do? And you realize, I could fill out this religious exemption form, And I'm not doing it because I'm against vaccines, but I'm doing it because we've kind of built a system that's made it hard for people to get vaccinated. And so we've been talking about it in terms of a convenience exemption, right? So it's more convenient perhaps to fill out that exemption form than it is to actually jump through all the hoops to getting your kid in to be seen and get vaccinated. And so we're concerned about that because these aren't parents who are vaccine hesitant. These aren't parents who don't want their kids protected. These are just parents who can't get through all the barriers we put in front of them.
Okay. Wow. Yeah, I didn't even think about that, I guess, as part of it. So basically all they have to do is fill out a form now, and it just has to be on file, right? And
Correct.
that's it.
Yeah.
Okay.
I don't know, Elizabeth, do you have something more to say about that one?
No, I would just say that part of the important work that Natasha does and that we do and all of the members of Iowa Immunizes is to address those barriers and to make it easier for people to do what they want to do, which is protect their kids, protect themselves. So having more opportunities for community clinics and things where people are at. And there's a lot of Iowans across the state that work in local public health and clinics and hospitals that open up at different hours of the day, all sorts of things, and have mobile clinics and are trying to, we saw this during COVID. We really saw this during COVID where there were clinics everywhere, which is great. And we need to be doing that for all vaccines too. And so we're working on that. We have an immunization equity committee within Iowa Immunizes that addresses access. We have researchers that are looking at where in the state those gaps are and where it makes a big difference to put, everybody has limited resources. So where do we need to put those resources?
Sure.
We really want parents, they like, Natasha said, they want to protect their kids, and sometimes it's convenience. You think you're gonna take care of it next month when I'm there for the sports physical. Well, then that gets pushed off too. So how can we make it easier for parents? And that's what and part of that is just education. Part of that is, having reminders and having the social media ads and all of that sort of stuff, just to make sure that we remember that as part of our overall health. It's not just making sure we, get the right foods and get exercise and fresh air. It's also wellness. A big part of that is staying up to date on all our recommended vaccines.
Sure. Well, that was going to be my next question. I was going to ask what's being done to kind of promote the vaccinations. And so is there anything else that's coming or people can look for or anything like that?
Well, I think it varies where you're at. We love the fact that we have this research network because we can see, what has worked, what are things that Natasha and their colleagues across the state, across the country, what works as far as messaging. Sometimes it's, we want to do all these like fear-based messaging. Well, that doesn't work with all vaccines and with all population levels. Sometimes it works with certain generations that may remember vaccines, but it doesn't work with everyone. So are there other types of messaging? And it's a science, and so there are different theories of communication, and so it's helpful to look at those different theories and to see what has been shown to work in other areas. What are some evidence-based strategies? And also within the clinic, there are a lot of things that can be streamlined within public health agencies, within clinics, as far as reminders, electronic health records, prompts for clinicians to talk about certain vaccines at certain times, as well as education. Physicians, we have a lot of new physicians, or a lot of physicians that haven't seen a lot of diseases or are kind of worn down and burnt out from COVID and all the anti-vax sentiment from COVID. So what are some strategies that clinicians can use? I mean, they are all in this because they love their patients and they want their patients to be healthy. Sometimes it's, being able to talk with other clinicians or getting other strategies, other scripts, at least, for how to talk about vaccines and stay, making sure that you're still that trusted person with your patient, because we do know that people really value what their healthcare provider, what their nurse, what their pharmacist has to say. That's what matters most when it comes to any of our sort of messaging. We could get up there and talk all we want. We could have all of the people from different areas, politicians, everything. But when you have your doctor saying, hey, this is something I really recommend you get this vaccine. You're at this great time right now. Your body is primed for this. This is what you need to do to protect yourself. I did it for my kids. kids, or my family went this last weekend and got it. I mean, those are the sorts of conversations that matter. And here in Iowa, we like to talk to each other, and we all know each other, especially in the rural areas. And so it does make a big difference when those providers can have those important conversations.
Sure. I was gonna say, do you think people, I mean, just because of, the times that are happening and all the information out there, do you think people are still listening to their provider recommendations, or do you think they're
Oh,
not?
for sure.
Okay.
For sure,
Okay.
for sure.
Okay.
And we do, to kind of build upon that, we did a lot, many different organizations did a lot of outreach during COVID, and we're still doing that. We're finding, going where people are at, not just health fairs and kid health fairs, but for instance, we had a booth at the USA skateboarding event in Des Moines, which brought together skateboarders from all across the country. We had table and provided information at the National Senior Games, which brought together seniors. It's kind of the Senior Olympics kind of thing, from everyone across the country. Having information there, and at farmers markets and a variety of different things. We do a lot of work with the arts community, so we're partnering with the local theater, and having a kind of a panel presentation coming up at the end of the month. Yeah, so all sorts of different opportunities just to make immunizations are just part of a healthy life, part of what it means to take care of yourself, take care of your body, and take care of your community.
Sure. Well, I was gonna say, is there any other, I guess any other way to, I guess, promote it? I mean, it seems like, they're pretty readily available, even if you didn't go to your doctor's office, like going to a pharmacy and getting a flu shot.
They are, but there are restrictions when it comes to certain vaccines. Not all clinics or
Sure.
pharmacies carry them. And then, of course, coverage for those vaccines. So I don't
Well,
have the numbers right in front of me. Maybe Natasha knows, but we have we have a lot of Iowans that are covered by Medicaid, that are covered by the vaccine for children's program, and we also have a vaccine for adults program. But not every pharmacy, not every clinic are providers of those vaccines. And so there are limitations. I could take, if I was a parent of some kiddos that were on VFC, that parent could take their kids to the pharmacy during COVID. And we had special carve outs for that legislatively in Iowa. And so we could do that. That parent with that kids cannot go get their kids up, MMR shot at a pharmacy right now. Those have to be at VFC providers. And in Iowa, those aren't pharmacies. There's all sorts of different legislation things that, that may change that. But those barriers do exist. And those VFC providers may not be in every community. We do have them in every county, but, we have transportation issues, we have childcare issues, we have, work issues, things like that. So those are a variety of different things we're looking at. I don't know, Natasha, if you have any strict numbers on that, but we do know that, those are Iowans that may not have coverage.
Yeah, I mean, I think that access issue is really key. When you walk into Target, they say they have vaccines, but it's not, not everyone is going to be able to access them because of the insurance they have, or because of the ages, or because of the vaccines they need. So we don't have this really great comprehensive system where you could kind of, get vaccines for everybody through multiple doors. And so that's something that's really a struggle, and especially for kids. If you have to go to that primary care provider, getting into that primary care provider, getting an actual appointment, those are barriers we see. We're lucky that we have really strong local public health in our state. And so those people are on the ground in every county, working really hard to get people access to vaccines. Some county public health do vaccinate, and they offer clinics. Some of them are able to refer out to others. But we also have health systems that are really pro-vaccine. So, they're working to kind of get vaccine to where it needs to be. But it's not easy for people to access healthcare right now.
Sure. No, I understand. I was just saying, and how does this affect, like, I guess, jobs wise, with, funding cuts and things like that, with, like, at the university, or, other organizations? How is this going to affect the economy, I guess, eventually?
Well, I think
at
there are two things, right? Two things we kind of worry about. One, if people aren't using vaccines and they're getting sick or they become in danger of getting sick. For example, with the measles that we've seen in Iowa, if your child is not vaccinated and they've been exposed, then your child will be required to stay home. And I think it's like 31 days. And maybe fact check me on that one. So then you're a parent who has a child who cannot go to school or participate in any activities for 31 days. And we all remember what that was like in COVID and how disruptive that was, right?
Sure.
But now imagine you're doing it and it's just you alone, and there isn't a whole community, there isn't a school system that's now trying to educate your child online. You don't have maybe the support from a supervisor or a boss who says it's okay if you work from home for the next month. You probably don't necessarily have a job where that's even an option, right? And so there's that cost, right? So what's going to be the cost to people when people get sick or they've been exposed and they have to be quarantined? And so that's costs. Those costs are avoidable, right? It's avoidable for you to not be sick with the flu for a week and miss a week's worth of wages.
Sure.
And then the other cost is kind of what we're seeing at the federal level in terms of changes in whether or not money is being put into vaccine research and clinical trials, whether money is being put into the NIH, the National Institutes for Health, to actually do that research to develop those vaccines. Are vaccine trials happening? Many of these trials are very expensive, and some of them are funded by the federal government. Some of them are funded by industry partners, and industry partners might be more reluctant to make investments into vaccines because they don't make money off of vaccines. They don't make money off of preventing illness, right? Are they going to want to invest in a vaccine where they also see an uncertain future and not know if the federal government is going to continue to support vaccinations? And so would you as a company put money behind vaccine development if you weren't sure you were going to get insurance companies to cover it anymore, if Medicaid or Medicare wasn't going to cover it? And that's pretty big disincentive to not do that kind of work. And then at a kind of a much smaller level, there's people like myself and others at the university whose funding is tied to the CDC, the Centers for Disease Control and Prevention. That staff related to immunizations has been very significantly reduced in reduction in forces. Of course, we're not, and much of that work is on hold right now due to the government shutdown. But Elizabeth and I both work on two grants related to immunizations that are 5-year grants that employ a number of people at the university and help cover some of our salaries. And we just finished year 1. Year 2 started on Tuesday. We did not know that we were going to have year 2 funding until Friday. So at that point in time, all this time we've been both thinking, oh, we're going to be out of work.
Yeah.
And we've very scary. And we're only going to be guaranteed this 1 more year of funding. So we would get 2 years out of the 5 years that we were originally told we would have when we applied for the money. So there's those kinds of things that are happening too that makes it uncertain about what's the future of that kind of work going forward in Iowa. Okay.
Yeah, that's very scary, I'm sure, when that happens. Has stuff like this, I guess, happened in the past? Have we had this issue in recent times?
No, we have never experienced. I mean, I've been doing vaccine research since 2006. So almost 20 years now. I've never experienced, this happen where you applied for a grant, you received the grant, and then we're told we're not going to give you the full time. So that has never happened before. Certainly when there's been budget crises, we've gotten grants and they said, oh, you're going to have to shorten your budget by 5 or 10%. We just don't have the money to cover all of that. That has certainly happened, and that's understandable when the federal government is looking for money. Everyone has to pitch in,
Sure.
but we've never had this happen where grants have been truncated.
Okay. Anything you can add to that, Elizabeth, on the?
No, I will just say it has been a lot of unease in the world of immunizations, specifically since March, when much of the funding was rescinded for. I have colleagues across the country that the coalitions have folded, or they've lost some of their funding that were passed through state, and yeah, that's a lot of uncertainty when we all just want to keep doing our job and have great connections and are doing good work and are seeing results.
Sure. And the 5-year grants that you were talking about, was that for specific things within the vaccines, or was it like a general grant? I mean, can you explain a little bit?
Yeah, I can talk about both of those. So one of them was this grant that we received as part of this Iowa Immunization Research Network. So our ability to be a center that works together with CDC to do research that helps them understand how to basically how to handle the challenge of vaccine hesitancy. So Aaron Schurer, who's in internal medicine at the University of Iowa, and I are co-leading that grant. And the idea is we're trying to understand what drives vaccine hesitancy. What are the things that are, in our psyches, in our brains, that kind of influence whether someone's vaccine hesitant or not? Because we know just providing people with information doesn't change whether or not they're vaccine hesitant or not. So it's not a fact that people just don't know the data, and if they knew the data, they wouldn't be vaccine hesitant. So that's really important work, especially as we're seeing vaccine hesitancy increase. The other project is a little bit more of a fun project. Elizabeth also works on that one. And this is where we're taking a model, an intervention that we developed to use dental providers, so dentists and dental hygienists, to educate parents on the association between the HPV virus and oral pharyngeal cancer. So oral pharyngeal cancer in Iowa is this cancer that kind of happens back here in your throat and oral cavity. And it is on the rise in Iowa, actually quite steadily. And we're number 1 in the country right now for oral pharyngeal cancer. But most oral pharyngeal cancer is associated with the HPV virus. And so if we can get people vaccinated against HPV, they're not going to get oral pharyngeal cancer. And so we train dentists and dental hygienists how to talk to parents about the connection between the HPV virus and oral pharyngeal cancer, how to recommend the vaccine, to tell them it's very effective, very safe vaccine, and then make a referral to a place where they can get the vaccine. Because in Iowa, unlike some other states, dentists can't provide the HPV vaccine, but they can certainly say, go to your primary care provider, they have the HPV vaccine. Go to the local health department, they have your HPV vaccine. So we've designed an intervention that we've tested in a pilot program in a few dental offices across the state. And now we're doing it much larger. And so we're conducting a study where we are recruiting dental offices to receive the intervention, and then half of them don't receive the intervention. And then we're going to look at the differences and see if we can look at differences in vaccination rates and whether dentists and dental hygienists can be a good way to get kids vaccinated.
Oh, okay. That's really interesting. When did you notice the cancer, the rates were going up, I guess?
So they've been going up probably since about 2016. And it's kind of a very kind of sharp increase. There's still not lots of people, but it's going from very few people to more people. And most people don't know about oropharyngeal cancer. I mean, it's not as common as colorectal or breast, where you probably know somebody who have had those cancers. But it's a really devastating cancer, because if you can imagine, if you have cancer of something back here, right, and they have to do surgery, they're removing part of your throat, part of your oral pharynx, right, part of your voice box, and so all these things, right, are related to breathing, related to eating, swallowing, related to talking. And so for many people who get oropharyngeal cancer, they can have lifelong negative health outcomes. Some people will forever not be able to swallow food, right? They'll have to get food from a different, like a port, and not chew and swallow food, right? Some people will have just, very long and painful recoveries, as if you can imagine, very sensitive tissue we have in there is getting repaired and is trying to regrow and trying to be healthy. So a lot of unnecessary pain and suffering happens to Iowans because they're not vaccinated against the HPV vaccine or HPV virus.
Okay. And what's the ages again for the HPV? It's between...
So they get it as young as 9.
Okay.
And should get it before 17. So if you get it after 17, it's less effective. But the earlier you get it, if you get it in that like 9 to 12-year-old range, you are really getting it at a time when the immune system is ready to process that vaccine. You're going to get a great immune response. It's going to get you're going to get it in a child before they're exposed to the virus, and so you get your best bet at those ages.
Okay. Is that like a one-time shot, or is it?
It's a 2-time shot if you get it before you're 15. If you get it after you're 15, it's a 3-time shot.
Okay.
So encouraging, if you get it early, you don't have to get 3 shots, right?
Sure.
And just for a little, I work at the international level too, for just a little tidbit. There are some countries that have gone to a 1-shot dose, which is very interesting, right? Because it's so much easier to get 1 shot in a kid than it is to get a shot and then have them come back in 6 months and get another. So maybe at some point in time, the United States will also be in a position where we can just give 1 shot out.
Okay. Do you know where that's at, or?
Right now, it was actually supposed to be discussed by the Advisory Committee on Immunization Practices, which has been in the news quite a bit recently. It was supposed to be on their summer schedule.
Okay.
But if you've been following the news on this, the ACIP, the Advisory Committee on Immunization Practices, was disbanded. Everybody who was on it was asked to leave by the current Secretary of Health and Human Services. And then new people were appointed. So it was supposed to be on their summer docket or agenda, but because of the disruption in terms of folks being asked to leave and then new people joining, those old agendas were not kept. And so it is no longer on the agenda for the Advisory Committee on Immunization Practices.
Okay. Okay. So I was just saying, sorry, Elizabeth, do you want to add? Okay.
No, I don't have anything to add. Natasha did a great job.
Okay. I was going to say, are there some other new vaccinations or innovations coming up that you guys could tell us about, or is there anything else that we didn't already want to talk about?
Well, there's a lot of different technologies, and Natasha can probably jump in here. She's closer to the colleagues there, but there's also a lot of work being done at Iowa State University. We have the Nano Vaccine Institute, and they are doing a lot of work with different delivery systems of vaccines. So for those vaccines that don't need to be through a needle, there's different patches, or what do they have, the inhaled, and all sorts of different types of things. I think there's even dissolvable thing. I mean, it's just amazing, the technology that we have going on right here in the state and across the Midwest. And that was based on federal innovation from 50, 60 years ago, I think, right, Natasha, that the federal government partnered with universities to be the innovators, and Iowa was one of the lucky ones that got to lead the way in that. And so there's a lot of great, I don't want to speak to all their work, but those are all, you can find that online too at Iowa State University. And then of course new diseases that are being targeted. You've probably seen in the news different vaccines for additional cancers, additional vaccines using different technologies. Anything else to add there, Natasha?
I don't think so. I would, though, encourage people to think this nano vaccine work that is done at Iowa State is really fascinating. And if you can imagine, it really comes out of veterinary medicine, right? Where, a farmer's got a bunch of livestock that need to be vaccinated, and, the time it takes to individually give each cattle, each hog a vaccine is that takes a lot of time. It takes a lot of person power, right? And so, how else can you get vaccines in animals in a really easy and efficient way? And it turns out, hey, animals don't like shots any more than people. And so, how can we use some of those technologies with people? And there's just some fascinating work going on. I mean, imagine how great it would be if you just like got a patch to put on, right? Everyone got a patch.
Sure.
So I think that's really exciting. I know there's a lot of diseases that we hear about in the news, like Ebola. There's vaccine trials from that, HIV. They for a long time they've really struggled with trying to find a vaccine for HIV, and we're getting much, much closer. Lyme disease. We used to have a vaccine for Lyme disease, but it was not very effective. It was only, don't quote me on this, but it was like 25 or 35% effective, which is really not great, right? Those are not great odds. And so they've got some much more effective Lyme disease. And although, Iowa isn't like one of those hot spots like New England is for Lyme disease, we certainly are one of those emerging places where there's a lot more concern about Lyme disease. And I know a few people who've had Lyme disease in the past few years. I'm sure you all do too. And having the opportunity of having that vaccine so we don't have to stress so much when we see a tick crawling on us would be pretty exciting.
I think I would stress anyway, but yeah. Just being honest.
They are kind of icky.
I know.
I just saw one development, and all of these are year-long, decade-long processes, but scientists working on vaccines for allergies, and how amazing would that be? Obviously, allergies are annoying, but also there's life-threatening allergies too. So all sorts of exciting things that scientists are doing. Sure.
I was gonna say, and usually like the clinical tests, like on stuff like this, how long does it usually take to
it takes a long time until when something is developed, like just trying to develop the vaccine, right, all the way to being a shot in the arm, it can take 20 years.
Oh wow.
I mean, it's a long process. I mean, part of it is that, right, we're really thorough and careful and make sure that we're not harming people, right? So there are lots of safeties. There's lots of points at which both the federal government and university researchers and pharmaceutical researchers are going in and checking and making sure, like, is this safe? Is the formula safe? Is it in the right amounts? Are the doses given in the right amount of time? And so, that kind of safety and that kind of precision, it really takes a lot of time, a lot of effort. It's very unusual, like the way the COVID vaccine was developed, because that vaccine was already pretty much halfway developed by the time COVID came. We were really fortunate to be able to take advantage of that. The next pandemic we see, it might not be a virus that we've already got kind of a half developed vaccine on. And we might be starting from the beginning, which would take a lot longer than what we saw with the COVID vaccine.
Yeah, I know. I think, and just the average person probably doesn't think about like that. It is a long, drawn out process, and it's not like they're just, testing these quickly and throwing them out on the market. I mean, that's not possible even. And so, do you guys think about that? Like, are you expecting the next pandemic?
I mean, I'm in public health, so my job is to expect and be prepared for the next.
Sure, I know. Right? I guess that's an obvious question for you.
Yeah. And I think there are things people are watching, right? We just saw there's more bird flu cases in poultry in Iowa, and so we're concerned about that. We're concerned when we see things transfer from like birds to cattle, which we've seen. And so I think there's things we're watching. A year ago, there were a lot more people and a lot more systems watching and monitoring this and doing surveillance and being able to understand. So we might be able to see an early signal if we see people developing a certain kind of illness that would worry us. Okay. Right now, we're in a position where those systems have been largely dismantled. So there are not as many people watching. So I think, we will catch the next pandemic later than we caught COVID because, in terms of understanding where it was, because it will be much more widespread. That I think worries us. Elizabeth, I'm sure you have something to say on this.
Yeah, I think you captured it great. There's obviously more and more zoonotic diseases as well as the tropical diseases, and with changes in climate, and that is definitely a concern even here in North America. And there is that concern that we don't have those relationships on the ground in different countries to track that and to kind of hear when there's, as they say in medicine, the zebras versus the horses. This is something different and new and needs to be studied. It's not a routine disease that's found in the area. So that is worrisome. As Natasha said, in public health, it's not we do know that there are other things that we need to be working on. That's the importance of public health, that the quiet business that we do is preparing and listening and being in touch with all of those different systems working together. And we have had a great system in place, and hopefully we can get back to that.
Okay. I was just saying, anything else you think is, you mentioned like the measles outbreak, and is there any other ones that are out there that Iowa maybe in the...
We are seeing increases in pertussis, which is whooping cough, in other states. I think that was one that just came across. Some of those, those are horrific deaths. We don't like any deaths, but of course, when babies are struggling to breathe, that is just hard to imagine. That as well, when it is something that could be preventable.
Sure.
I'm trying to think of other ones. Pertussis is which one?
Pertussis is the ones. Yeah, pertussis is the one I'm concerned about always. Yeah. COVID is still here. For some people, it has moved to the category of, it's just a cold. But I can say, from the past few weeks in my classroom, there have been students who've been out with COVID and have been very, very sick. COVID is still out there. There is a COVID vaccine available. We're lucky in the state of Iowa that there are ways to get the COVID vaccine. It's not as easy as it used to be, but you can still get the COVID vaccine. We still haven't finished with our past pandemic virus yet.
Sure. And as we mentioned at the beginning, influenza doesn't get the respect it deserves, I think. Actually, last season was our worst in over a decade for pediatric mortality related to influenza. And so that is devastating. And that's something we continue to try to increase those immunization rates and to boost our herd immunity for that.
Sure, and it is important to get these each year, just because the virus changes, right, each time.
Yeah, viruses are smart, and they mutate because they want to infect us, and so we have to be a little bit smarter. And so each year, the influenza and the COVID vaccine changes a little. The vaccine changes a little bit so that it gets ahead of the virus.
Okay. Well, did I ask you something or did I miss something in my questions that maybe you guys wanted to bring up or talk about?
I want to talk about, I forgot about this when we planned this, but something exciting that Iowans just recently created, Iowa Immunizes. We worked with a local Iowa artist and the chair of our coalition, Dr. Nathan Boonstra, who's a pediatrician in Des Moines, and we wrote a children's book. And so we now have that available. It's called Bye Bye Big Sick. SICK, so bye bye, and it's on our website, on both the Iowa Public Health Association and Iowa Immunizes website, and we have a kids version of it and a board book version of it. So it just describes Wren and her stuffed animal as they go to the doctor and what to expect, and how Dr. Danny explains immunizations, and Wren is very brave and gets her shot and protects herself. So that is very exciting and super fun that we were able to get that created and offered to Iowans and offered to pediatricians and providers across the state, and that's available in English and Spanish. So looking forward to getting that out there.
Oh, okay. Well, that's very cool. So is it already out, or?
It is. Okay. It's available.
Okay.
It's right here.
Oh, okay. Great. No, that's great.
Yeah, it's fun.
So that was Iowa Immunizes that did that?
Yeah, Iowa Immunizes, Iowa Public Health Association, and Iowa Medical Society.
Oh, okay.
We all
Okay.
work together on that. So,
Well,
and we have
great.
all sorts of different Iowans that were our scientific advisory committee and reviewed all of the materials that we produce. And so lots of different Iowans had a hand in that. So there's only a couple names on the book, but there's a lot of people that participated.
Okay. Well, whose name got to be on the book?
Well, our Dr. Nathan Boonstra, and then our
Okay.
artist from the Des Moines area, Claire Cedovic. So they are the ones that
Okay.
are on the book. And then our translator is Maria Torres from Council Bluffs.
Okay. No, that sounds they're very fun, very exciting. I'm glad you brought that up.
Yeah, that's a fun way to end.
Yeah, there you go. Natasha, I'll give you the last word if you want it.
Well, I'm going to just urge people to go talk to their healthcare provider.
Okay.
We're really lucky that in the state of Iowa, we have something called the Iowa Immunization Registry System. And so all providers are tied into this. So they'll be able to look at your entire immunization history and be able to tell you if you're due for anything. Everyone right now should be thinking, like Elizabeth has said, about COVID vaccine and flu vaccine. And we always say, get your flu before boo, get your flu vaccine before Halloween. And then, check on your MMR status, your measles, mumps, and rubella status, because we do still have concerns about measles in Iowa. And so for some people, they may need a booster. For some people, they might have missed their booster. So check on that. And then there are some newer vaccines for older Iowans, and I get to count myself in that group. But we have the RSV vaccine for older Iowans. There's a new pneumonia vaccine that covers more variants. And then there's a new shingles vaccine called Shingrix, which also helps cover shingles. And for those of you who aren't aware, shingles basically comes from the chickenpox from the chickenpox virus. And so for those of us who were young or old enough to get chickenpox, we've got zosters, or a virus hanging out in our body. And it waits for a moment when we might be a little bit weakened and comes out as shingles. And if you've ever witnessed shingles or had them, you do not want them. Very painful, very debilitating, really gets in the way of having, daily life. And so getting that vaccine can prevent you from having a shingles outbreak. So I would urge people to just talk to their provider and make sure they're up to date on the things that they need.
Okay. And then I was just going to bring it back. Somebody was asking where to get the book, and it's on iowaimmunizes.org, right? Website. So you can get it there. So I want to thank you two for being here today. You were great. I appreciate all your information and advice. And I hope you guys join us again for Iowa Ideas.
Thank you so much for having us.
Sure. Thank you. Have a great day.